I'm going to approach this from a generalist perspective. Gleeson and Associates, which is on the slide, is a vehicle I use to become involved in early stage technologies, which is my sweet spot. And I will not become involved in an early stage situation unless I'm willing to put some of my own money in, which I find for me is a discipline, and that's why I do that. It's a good discipline. So what I'm going to try to do is give you a bit of an overview from the perspective I take, and hopefully that's helpful to you. Some of it will probably be a little bit redundant since my colleagues have covered the area so well. So what investors look for is very easy. They look for three things. They want to make money, they want to make more money, and they want to make still more money. And I say this partly in jest, but because over the years that I've been involved, and I've been a venture capitalist, I've been a biotech CEO, I've been an entrepreneur and created my own company, and now I sort of am more polygamous in getting involved with several initiatives. I've met so many people, particularly inventors, not exclusively, also business people, who really rant against the amount of money that somebody's going to make on their invention. And some people actually will not get involved early enough with people that can help them because of that. And as Cameron described very eloquently, no matter who puts money in, they're going to make a lot of money if you're successful. And that's what creates the flywheel that solves the problem of where does the money come from. We have to celebrate success, but we also have to allow all of us to be successful in the space and to take on board those people early that can help you. And this question of venture capitalists, in particular, which comes up over and over and over again, any audience I'm ever in, it is true there's a lot less venture capital money. That's absolutely true. And the dynamic for them is very difficult. But this, demonizing of the venture capitalists is quite short-sighted, because one of the things that attracts them to a community is the ecosystem of support and co-investors and successful entrepreneurs and angels that they know will be there to support the companies, whether in terms of money or in terms of expertise or in terms of board representation or in terms of networks and mentoring. And so ensuring that that is built is extraordinarily important. And fortunately, there's much more of it taking place in Ontario right now. So today's environment's very clear. Private sector capital available to biomedical is shrinking. You've heard that probably all day and recently on this panel. Industry productivity is declining. It's under enormous pressure. That's particularly true in the biopharmaceutical world. New models of open collaboration are being developed, which can create mechanisms to develop early technologies. But overall, it's quite unclear how the industry itself and new models are going to evolve. And I spend a reasonable amount of my time with colleagues trying to figure that out and see where we can make some money as a result of that. And it's by no means clear. So how do we respond to that? Or when I'm looking at opportunities, how do I try to respond to that? One is to be brutally honest about the opportunity and to be laser focused on what need or value that opportunity creates. Not all opportunities should be a company. Not all new technologies will become a product. Or if they become a product, they're part of someone else's solution and not a standalone solution. So it's important to be brutally honest. Also, to create and stress test what I call a financing roadmap to increase the likelihood of success. Very seldom have I ever seen that done, scientists or even early entrepreneurs. They think very much about the next 100 grand that they need, or the next 50 grand, or the next experiment, or the next tweak of the prototype. But you really need to think a little bit further down the road, particularly when the timelines are so long, and when you're attracting people in on the promise that somehow, some way, they're going to make money other than just trusting you. And it also allows you to identify the inflection points where value can be created, and around that value creation you can raise new money. And you can do that at better terms for yourself, quite frankly. And then to concentrate on capital efficient models. One of the speakers commented about angels not liking to invest in a lot of infrastructure. And that's what I mean by a capital efficient model. Minimize the spend on non-essential items. And non-essential items can be office space. If you can work from your BlackBerry, that's better than having to pay for an office. If you can work out of your host institution in an effective way and get the experimental work done, that's better than having independent labs and paying for them. If you don't have to take people on board full-time and can use them in a consulting capacity, that's better still. Pursue open collaboration wherever possible. That's becoming more and more a theme in the industry. It's becoming more and more possible in Ontario with all of the initiatives, both provincially and federally. And most of the institutions now are more amenable to this. And then to align at each stage of value creation with the appropriate investor type. So I'll talk a little bit about how I look at that anyway, the types of investors and how to differentiate. You've heard much of this. But there are, of course, angel investors and entrepreneurs, often called high net worth individuals. Generally, they've been successful in other industries or in life sciences. There are private equity investors. Venture capitalists are the most predominant, and certainly from an early technology perspective, the most likely you'll come in contact with. There are also institutional funds who invest in the venture funds and who also invest separately. And then there are stock market investors, because one can never rule out the public markets and using the venture exchange and other mechanisms to raise money. And there are retail investors there and institutional investors. I won't spend too much time on the third. So they all have common linkages, however, regardless of how you fund your initiative. Everybody's looking for a rate of return that's commensurate with how they perceive the risk. And that's tied to their cost of capital, however they define that. And it's important in taking money from people to understand how they view their cost of capital. And it is different across the different categories of investors. Oftentimes, investors are looking to fill a psychic need or an organizational mandate. So in the case of venture capitalists, it's the type of investment they're looking for, largely. In the case of angels, it can be that they want to give back or a variety of other objectives. And everybody is looking for a way to monetize. I prefer monetize because everybody seems to hate the word exit. But if you can't get out of an investment, you can't go into it. That's how most people look at it. It's not like raising kids. The investment is intended to go. So each investor has a unique profile. So VCs, generally they're domain experts and they're professional investors in the space. They usually have quite strict criteria. They have defined models by which they operate, which are mandated by their investors and how they function. And they tend to have a 3 to 7 year horizon. There are exceptions to every rule, and no question about that that is the case. But generally speaking, that's how they operate. Private equity funds tend to be less expert than VCs, more expert than the average investor. They are professionals. They often have life sciences interests. They're becoming more and more uncommon. And they have shorter horizons, certainly less than 3 years. Angels are business professionals who may or may not have life science domain expertise. I've seen both. It's great if you get somebody with domain expertise. It's better, but I've seen both. And I've seen a lot of mining people that fall in love with the idea of being in medical technology. They seem to love scientists. And when things go wrong, you have to remember that not all the angels stayed in heaven. So when things go wrong, it can be quite ugly. They have variable, my experience has been that they can have quite variable interests, different motivators, and different time horizons. And it's important if you're going to align with angel investors, whether it's an individual that's really becomes a main benefactor for the company or it's a group, that you understand their motivators and time horizons as best you can so that there's alignment. And then, of course, there are retail investors when you are a public play. They're the least expert of all. They tend to be fashion-type investors, and they really have negligible time horizons. And that can be both good and bad depending on the stage of development of your company. So what do VCs look for? Some of this has been covered. I'll go through it quickly. They look for an alignment with their fund's mandate. That's first and foremost. The type of technology, the stage of development, whether it's a product or a disease area, they all have different aspects. Some look for platforms, some look only for products. The quality of the opportunity, and this is very important to keep in mind. They are looking for compelling differentiation, generally speaking, either in terms of the business model or the technology itself. They're not usually looking for Me Too opportunities or incremental improvements. They're almost always looking for terrific, adaptable people who have a track record of some sort. It doesn't mean that an academic inventor needs to have a business track record, but they need to have a very strong track record. And someone mentioned earlier that things often go wrong. Adaptability is extremely important. There needs to be a path to market and monetization. So clear potential to create third-party value. Somebody will have to care about this technology at some point, enough to pay a significant dollar for it, and an exceptional ability to execute with a sense of urgency. And often, and one of the characteristics that I was thinking of when I was listening to Cameron's story is how early on he and his colleagues obviously jumped into the company, and how early on they obviously got sales. And these are pretty important characteristics. Oftentimes, being able to raise money is part and parcel of a willingness to show that commitment that will encourage somebody to invest. And then intangibles. VCs are always looking for a supportive network and an ecosystem. And sadly, that's sort of fallen off in Ontario, and I think is one of the reasons why it's so difficult to attract US VC capital here and have it stay here. Often companies are moved. And the more our ecosystem builds, I think personally, the more that will change. So angels, I think it's a wide variety of things they look for, and my colleagues know this better than I do, but this is just my perspective. Fascinating technology, remarkable inventors and scientists. These are very, very successful people, and they want to hang around with cool people that are doing really good things. Opportunity to make a difference, particularly if they're crossing over from another sector. They may be looking for their next big thing, the next $100 million play. Often they want to build something, and they want to do something that's novel. And generally speaking, they're always looking for a solution to an unmet need. So what do you do about all of this? So I think the first thing is make sure you understand your own opportunity, what the problem is you're trying to solve, and how unique you are in addressing that problem. The more clarity you can have around that, the more you can distill the essence of that, the more likely you'll raise money. How big is that opportunity using reasonable assumptions? A reasonable assumption is not that you'll get 90% uptake of every person on the planet. And I have seen so many business plans that project huge markets. We're going to get it all, then we'll get another market, then it'll be labeled for something else, then it'll go into other industries. It's silly. You have to really get to a granular level sensibly. What needs to be demonstrated to validate the solution? So what is the minimum you need to do, but you cannot not do to validate the solution? Crucial, absolutely crucial. And not everybody thinks that way, I can assure you of that. So that's very important. What's the realistic path to clinical approval and market introduction? We're in the medical field. It will somehow have to get regulatory approval in virtually all cases. What is that path? Again, being realistic. And then how long will all this take? Then make a plan. So make a plan of that, sketch it out, test your assumptions, do some market reconnaissance. Time spent in reconnaissance is seldom wasted. It's a good thing to do. And then seek advice from people that have been where you want to go. So there are more and more successful medical device entrepreneurs in Ontario. Find them and reach out to them and get advice and test your plan. Map out the key milestones that you need to achieve to demonstrate a proof of concept, to show commercially relevant progress. So doing the same experiment sort of horizontally in 1,000 different ways is not showing commercial progress. You have to think about what actually will show commercial progress. Tangibly increase the value, and then sketch out your plan of how much money to get to each point. People that will put money into you will be comforted by that. So that gives them a sense of what they're getting into. And then execute the plan. So you need to prepare a pitch deck in some way that aligns the capital you need with a stepwise approach in how you're creating value. At least this is the approach that I take. Everyone can take a different approach, obviously, but somehow you have to give parties that you're speaking to a sense of where all of this is going and that you've thought it through. Wherever you can, maximize public sector funds to minimize the amount you need to raise and to leverage capital you do raise at each stage. And more of that is becoming available early on. And you know, I'm very familiar with plans in the US and in Europe, and anyone that ever asks me, I say to them, you know, we need something like the SBIR program in Canada. My pet idea is always to just change a couple of our existing programs and turn them more into an SBIR program. But the reality is that there are programs available now. And you need to be entrepreneurial, or inventors need to be entrepreneurial in thinking about how to tap into them to move their programs forward. Exploit open collaboration wherever possible, stay virtual, and then match the type of investor with the stage of development as best you can. So what I try to do, in my case, this is just my approach, I try to look for truly differentiated products or technology. I try to understand the need and the size of the market. It doesn't have to be a gazillion-dollar market. I don't believe any of those projections, but it has to be a sizable market. I look for a pragmatic, tractable plan. Can it actually be done? And can it be done in a way that you can deal with the obvious hiccups that you're going to hit along the way? Will there be measurable and value-creating milestones? Is the monetization route believable? Everybody says someone will buy us, or they say someone will partner with us for, you know, $500 billion, or we'll have revenues. But is it believable? Is it credible? And many things are, actually. But it can't be just a token thing that you say. And then how much financing, realistically? I was looking at an opportunity yesterday that is about as early an opportunity. This is not medtech, this was in the drug development. It's about as early a piece of science as I've ever seen. And, you know, very, very smart scientists in the room trying to convince me that 1 year from now, they'd be filing an IND. And, you know, they hadn't done any toxicology work, they hadn't repeated the experiments, they hadn't done multiple doses, none of those simple things that, and it destroys credibility of very accomplished people. So that's something to guard against. Be very sensible about what's needed. And then can it be executed in a virtual way? Because that is becoming more and more an important theme. So in closing, the environment is brutal. I've learned not to complain about it. You just have to deal with it. That's the reality. But successful people are successful. I mean, so there are ways around it, and there are examples on this panel right now. You don't have a lot of room for error, however, in a market such as the one we're in. So ensuring that you use your capital that you are able to raise in a maximal manner is very important, because you can't go back and say, oops, we kind of got that wrong, you know, we should have done 7 rats, we only did 3, so we need another couple $100 grand to do the same thing over again. It's not a good idea. I'm not saying mistakes can't be overcome, but think very carefully about what is done to maximize the use of it. Capital efficiency, open collaborations, and then alignment, which other speakers have mentioned is very important. So hopefully that's of some use, and I'll look forward to the Q&A. Thank you.